know, February is Heart Awareness Month, and this lecture is more geared towards women with cardiovascular disease, but really the concepts apply to both men and women, so it should be applicable to everyone. So thank you guys for coming out. I'm one of the newer physicians at Ingalls Hospital, and I'm at Tinley Park. Right now I have an office over there, and shortly I'll be in this building as well in a couple weeks. And I see some familiar faces. And I like to see the red also. I'm kind of running out of red outfits now. It's a long month. I'm glad it's almost March now. But thank you all for coming out today. Okay, so we can go ahead and get started here. So the Heart Truth it's a national campaign helping women, especially women 40 to 60 years old, understanding their risk of heart disease and taking action to protect their heart health. This is a national lecture series, and it's sponsored by the National Heart, Lung, and Blood Institutes and NIH, U.S. Department of Health and Human Services, and supported by the community government nonprofit. So you might have seen this, and I do have this pin, but I'm not wearing it right now. This is the national symbol, is the red heart dress to bring awareness for women with cardiovascular disease and try and get the message out there. Also, red ribbon sometimes you'll see. And today what we're going to talk about is what women need to know about heart disease and what heart disease is, risk factors, talking to your physician, and taking action to protect your heart health. What are some of the warning signs and signals, and getting on the road to heart health, and also resources. And the resources are listed at the back of your pamphlet, and of course at the end, we'll talk about any questions you might have as well. So this is not well known, and we're trying to spread the message, but heart disease is actually the #1 killer of American women. And we don't do a good job of marketing it yet. We're trying to get the word out there. You might ask, how is it #1? Cardiovascular disease encompasses heart attack and stroke because they go hand in hand. So that's how. So it actually kills more women than all forms of cancer combined. They've done a really good job in the media of marketing breast cancer, ovarian cancer, and that sort of thing, which is great. But statistically, actually, heart disease is the #1 thing that women really need to watch out for. So we're trying to get that information out there. And heart disease can permanently damage your heart and your life. If it's not treated, you can develop serious complications. Most women don't even know that their heart disease is their own greatest health risk. And it is largely preventable. There's a lot of things that we can do to help prevent this, which is important. The big thing is once something has happened where you've had damage to your heart, for instance, a heart attack, we have nothing in our power to replace dead heart cells with fresh, healthy ones. There are some things we can do if someone's had a heart attack to help protect their life and treat them, but nothing is better than being proactive and preventing that from happening in the first place. And we have a lot of information now and a lot of different things that we can do to help with that. So women can take action to protect their hearts. It is a now problem. Again, later might be too late. So what is heart disease? There are many different forms of heart disease. The one that you probably have heard the most about would be coronary artery disease, or it's called coronary heart disease, which is the most common. This is what we refer to when the blood vessels to the heart get blocked up, and that's when people have heart attacks, when they're not getting good blood and oxygen flow to the heart. Heart disease develops over years and progresses when the heart doesn't get enough nutrient-rich blood. What's the purpose of the heart anyway? The heart is a big muscle, and it basically pumps blood and oxygen to the whole body. So you can see if you have damage to your heart, you're not getting good blood and oxygen flow to all the organs in your body, how that can be so damaging. And as far as developing over years, they've done new research now, and they found that heart disease actually starts when you're a teenager. So it does matter what you do when you're younger. And, everything you do does count, but there's so much that we can do at any age to still help with your heart disease. So a term called atherosclerosis is a disease in which plaque builds up inside your arteries and it limits the flow of oxygen-rich blood to your organs. So if you can see in the top picture, this is your blood vessel going to the heart, and it's nice and clean and open. Now the one at the bottom has that yellow buildup. So what is that made of? A lot of different things. We call it plaque or atherosclerosis. It's basically a buildup of cholesterol, inflammatory cells, and sometimes blood clot also. So this is why things like controlling your blood pressure and cholesterol levels play a big part in trying to keep this nice and clean. When you get narrowing is when you can start to get symptoms such as chest pain, shortness of breath, fatigue, and whatnot. And when you have a complete blockage of that vessel, or occlusion as we call it, that's when someone has a heart attack. So heart attack, this occurs when blood flow to a section of the heart muscle becomes blocked, most often the result of coronary artery disease. So this is your heart. It's about the size of your fist, and it's right on the left side of your heart. And as you can see at the top there, the blood is trying to pump through the blood vessel, but there's some yellow plaque buildup that's making it very difficult. And when you're not getting good blood flow, that puts a lot of strain on your heart, and you can even have dead heart muscle tissue beyond that point. There really is no quick fix. Procedures like bypass surgery can reopen a blocked artery. So you might have heard of a CABG, which is a big operation where they try to bypass blocked heart vessels in your heart. And it doesn't fix a damaged heart. So once you have dead heart cells, we can't replace them. We can improve the blood flow and whatnot and maybe your symptoms, but we can't really reverse dead cells. This condition can worsen if it's not treated. It leads to disability or even death. And it's critical to realize that there is no quick fix for heart disease. There is some good news after all of that, terrible news. There is actually good news because it can be prevented or controlled. And prevention, a big part of it is lifestyle changes and sometimes medication if prescribed by a doctor. So sometimes, the biggest thing you can do is, and we'll talk about what things you can do to help in prevention, but doing just diet and exercise and eating healthy is so much better than anything we can do with medications. But sometimes people do need a little medication to push a little bit more to get them in the healthy range and protect their heart a little bit more. So why me? Why now? Young women need to take steps to protect their heart health. Since heart disease develops gradually and can start at a young age, teenager, as we said, risk factors rises in women aged 40 to 60. Estrogen levels drop during menopause. So estrogen, they found, actually protects a little bit with the heart. And so this is kind of why men run into problems with the heart at a little bit younger age than women. Once women hit menopause, they're sort of at the same risk and they equal out with the men. They've done, and I won't go into it now, but they've done lots of studies about trying to give women estrogen to see if that helps with the heart. But they found that when they try to give estrogen, there's some drawbacks and other side effects, and it doesn't help as much as we would have hoped as far as heart protection. Many women develop one or more risk factors for heart disease during these years. Older women also need to take action against their risks. It's never too late for women to protect their heart health. Some things that we can control. Smoking is a huge one. We all know now smoking has a lot of terrible side effects and can cause damage all over your body, including lung problems, heart problems, stroke problems, cancer. And it's tough. It's really tough if you're a regular smoker. And quitting is very difficult. However, now we have lots of new options. If you ask your physician, have a discussion with them. There are new medications, there's new treatments that have a much higher success rate. If you are a smoker, I don't want you to be frustrated if you attempted to quit smoking and then you started up smoking again. On average, studies have showed it takes about 5 times quitting before someone is successful. It's very tough. And there have been some research to show that actually the first 2 days are the days that when you really have a physical addiction. After the first 2 days, most of it is the mental addiction is so powerful and so strong, and that's the toughest thing to break. But there are some options out there to help you with that, and that will improve your health overall. High blood pressure is one of them, high blood cholesterol and high triglycerides, overweight and obesity, physical inactivity, diabetes and prediabetes, and metabolic syndrome. Metabolic syndrome is a new phrase that they've come up with to describe a constellation of symptoms and findings on your physical exam, including how high your sugar level is, certain cholesterol levels, how big your waist circumference is, depending on if you're a man or a woman, and some other factors that put you at higher risk than the average population for developing lots of problems, including diabetes, heart attack, and stroke. Some things we can't really control. You can't control if you have a family history of early heart disease. It's unfortunate, but some people have a significant heart disease I've seen in the 20s, 30s, having massive heart attacks, and it's very, it's heartbreaking to see that. But there's still some things that we can do to help with that. And one of the key things to know is to know your family history so that we can be more aggressive in preventing and treating. Age 55 and older for women, we can't control our age, but there's still things that you can do at any age to help with heart disease. History of preeclampsia during pregnancy. Preeclampsia refers to high blood pressure, very high blood pressure during pregnancy. Makes you a little bit higher risk later in life for developing heart issues. Some other risk factors would be sleep apnea. Sleep apnea refers to not getting good oxygen flow late at nighttime. You might have this if you snore really